Hello, my name is Dr. Dewan as Raja. Today I will discuss about the anatomy of the extrinsic muscles of the eyeball, also called extraocular muscles. We have two sets of muscle in the orbit, extraocular muscle and intraocular muscle. We discussed previously about the intraocular muscle that regulates the diameter of the pupil as well as accommodates the lens for vision. Today we'll discuss about extraocular muscles. The extraocular muscles moves the eyeball or elevates the upper eyelid. We have 7 extraocular muscles. This includes levator palpebrae superioris muscle. This is the levator palpebrae superioris muscle. Then the superior rectus muscle. Then inferior rectus muscle is here. Medial rectus muscle. This is the lateral view of the orbit. This is the medial rectus muscle and this is the lateral rectus muscle. We got that. Then this is the superior oblique muscle. This is the superior oblique muscle. And we have inferior oblique muscle. This is the inferior oblique muscle. The recti muscle takes origin from a common tendinous ring that covers the optic canal and superior orbital fissure and part of inferior orbital fissure. Okay, so extrinsic muscles of the eyeball, nerve supply of the extraocular muscle, superior oblique muscle is innervated by the trochlear nerve. Okay, so this is the superior oblique muscle. This is innervated by the trochlear nerve or the fourth cranial nerve. This is the superior oblique muscle. The muscle fiber has a pulley here or trochlea, then it goes posterolaterally. This is the muscle, and this is the oblique course. It is on the posterior superior aspect on the lateral part of the sclera. It goes there, and it's innervation by the trochlear nerve. Then lateral rectus muscle. Okay, you'll get the lateral rectus muscle. This is lateral rectus muscle. This lateral rectus muscle is innervated by the abducent nerve. The sixth cranial nerve is the sixth cranial nerve. All other extraocular muscles are innervated by the oculomotor nerve. Okay. So, how can you remember the nerve supply of the eyeball? We have a mnemonic that is SO4, LR6, AO3. SO4 stands for superior oblique by the fourth cranial nerve, LR6 lateral rectus by the sixth cranial nerve, AO3 all others are innervated by the oculomotor nerve or the third cranial nerve. Okay, we got the nerve supply of the extrinsic muscles of the eyeball. Okay, so we have to know the origin and insertion. Levator palpebrae superioris originate from the lesser wing of the sphenoid bone, superior and anterior to the optic canal. Inserts in the superior tertius, that is a part of the upper eyelid and skin of the upper eyelid. Superior oblique originate from the body of the sphenoid bone. Tendon passes through the trochlea or a fibrous pulley, inserts posterolaterally. Remember, it goes posterolaterally into the upper or superior part of the sclera. Inferior oblique, this is an exception. Inferior oblique, this is an exception. Okay, and the inferior oblique takes origin from the medial floor of the orbit near the nasolacrimal duct, and it as an oblique muscle, fibers inserts posterolaterally into the inferior part of the sclera or lower part of the sclera. Superior rectus means something very straight, takes origin from common tendinous ring. It inserts into the superior part of the sclera behind the sclerocorneal junction. Like inferior rectus, again its course is straight, not oblique, like the superior rectus. Origin from common tendinous ring, inserts anterior-inferior part of the sclera behind the sclerocorneal junction. Medial rectus originates from the common tendinous ring, inserts into the anteromedial part of the sclera behind the sclerocorneal junction. So these all rectus are anteriorly located behind the sclerocorneal junction. They have common tendinous ring as their origin. Like lateral rectus originates from the common tendinous ring and inserts into the anterolateral part of the sclera behind the sclerocorneal junction. Okay, so we got the origin. This is the tendinous ring of origin of the rectus muscle, medial rectus. This is lateral rectus, superior rectus, inferior rectus. And this ring covers the optic canal, the superior orbital fissure, and upper part of the inferior orbital fissure. Okay. Above that, we are getting the origin of levator palpebrae superioris muscle. Above that, we are getting the origin of the superior oblique muscle. Insertion is the levator palpebrae superioris inserting to the superior tertius and the skin of the upper eyelid. Okay, and the tendon of the superior oblique passes through the pulley or the trochlea, going posterolaterally, inserts posteriorly to the superior aspect of the sclera. But the inferior oblique is an exception. It takes origin from the floor of the medial aspect of the orbit near the nasolacrimal duct, and it inserts to the posterolateral aspect on the inferior part of the sclera. Okay, so we got this is the lateral rectus, that is the sclerocorneal junction. It inserts lateral aspect of the sclerocorneal junction posteriorly, posterior to the sclerocorneal junction. Here the medial rectus, again on the medial side of the sclera behind the sclerocorneal junction. Like the superior rectus, it is behind and above the sclerocorneal junction. We have also inferior rectus here, insertion here. So these recti are a bit anterior and the oblique are posterior. Oblique has oblique tendinous insertion. Rectus has straight or recti insertion. They have straight insertion. And among all the extrinsic muscle, the levator palpebrae inserts to the upper eyelid, not to the sclera, upper eyelid to the tarsus muscle and to the skin. We'll go to the movement of the eyeball. Movements in 3 dimensions. Elevation, moving the pupil above here. Depression, moving the pupil below inferiorly. Abduction. Abduction, that means away from the midline. This is the lateral rectus, making the abduction. Okay. Adduction, the medial movement, the towards the nose. If nose is here, this is the medial rectus, making the adduction. Deduction. Here lateral rectus making the abduction. Abduction. Internal rotation, intorsion, rotating the upper part of the pupil. Okay. Rotating the upper part of the pupil medially towards the nose. There is intorsion. Extorsion, rotating the upper part of the pupil laterally away from the nose, that means towards the temple. Okay, these are the movements of the eyeball. These are the plane. these are the movement in 3 dimensions. Okay, you have to remember that this is the orbit. It contains the eyeball, and the axis of the eyeball is different from the axis of the orbit. Certain angle here between them. Okay, movements of the eyeball, again, elevation, depression. There is the abduction going laterally, adduction going medially, rotating towards the nose, internal rotation, intorsion, rotating away from the nose, external rotation or extorsion. Okay. If we do the H test, function of the extrinsic muscle and their nerve supply, we can assess the nerve supply and functions of the extrinsic muscle by means of the H test. Idea is that patient should not move the neck and head. They will look straight to the finger or the pen of the examiner, and examiner will move the finger or the pen, and patient's eye should follow the examiner's finger or his pen. Suppose let's start from the right eye. So this is the right eye. So number 1, lateral rectus. So that moves the eyeball laterally. Then superior rectus muscle should move the eyeball above. Inferior rectus muscle should move the eyeball below. Okay. Then the medial rectus move the eyeball medially. Superior oblique muscle should depress the eyeball, not elevate. Its insertion is such a manner that it should depress the eyeball, the superior oblique muscle. Inferior oblique muscle, its insertion is like that. It will elevate the eyeball. We can also check the left eye. This is medial rectus. Okay, should move the eyeball medially. Inferior oblique should elevate the eye here. Lateral rectus should move the eyeball laterally. Here is the laterally, and the inferior rectus should move the eyeball inferiorly. Superior rectus will move the eyeball above. So this is the H test to assess the functions of the extrinsic muscles of the eye and to assess their nerve supply. Okay. Now we'll summarize the extrinsic muscles of the eyeball, their main action or function. Levator palpebrae superioris, it elevates the upper eyelid. Superior oblique muscle, it depresses, abducts, and internally rotate the eyeball. That means it causes intorsion. Both the oblique are the inferior oblique, superior oblique, they are the abductors. Okay, superior rectus elevates, adducts, and medial rotates the eyeball. Inferior rectus depress, adducts. So rectus here, these two are adducted, and the superior rectus medially rotates the eyeball. Inferior rectus laterally rotates the eyeball. Okay, we should add one S here, rotates. Medial rectus, its function is adduction of the eyeball. Lateral rectus, abduct the eyeball. Okay, and that's all about the anatomy of the extrinsic muscles of the eyeball. If you have any question, please feel free to ask me. Please share the information with your friends, and please support my channel. Please subscribe me. Have a nice day. Bye now.